Dr. Wright, thank you so much for joining us on MD Newsline podcast. Can you please introduce yourself to our audience?
No problem. It's my pleasure. So I'm Joel Wright. I'm a second year rheumatology fellow at UCLA. I've wanted to be a rheumatologist since I was 16. So this is something I'm really passionate about. And thanks for having me here.
Wonderful. So today we're going to talk about spondyloarthritis. And I just want to talk a little bit for people who are maybe more in general rheumatology, for instance. Can you tell me how you define axial spondyloarthritis versus peripheral spondyloarthritis
Right.
and psoriatic arthritis in 2025?
Right. So, all of these kind of fall under the same group of diseases. That's axial spondyloarthritis, which is specifically autoimmune disease which affects the spine. Axial, axis from the Latin, just central. So it affects the spine, the entire spine, and in particular that lower part of the spine where the spine joins into the back of the pelvis. So that's axial spondyloarthritis. And then axial spondyloarthritis, you can have some peripheral, meaning, hand, knees, or other joints outside of the spine involvement. But by by definition, axial spondyloarthritis involves the spine. And then you have the peripheral spondyloarthritis. As I mentioned before, these can cause, inflammation in the fingers or the tendons. And these, as you mentioned, would include diseases like psoriatic arthritis, inflammatory bowel disease associated arthritis, as well as reactive arthritis.
How has the shift from ankylosing spondylitis towards the broader axial spondyloarthritis changed who gets diagnosed and treated? Okay.
Yeah, so these terms are interchangeable. So the your ability to qualify for a diagnosis of either or, it remains the same. And the reason for the change in terminology is just the thought that ankylosing means, fusion, right? So ankylosing spondylitis, a lot of times the disease was associated with fusion of the spine. So changing it to axial spondyloarthritis, the thought is that you're able to give a better and a broader terminology for the disease that incorporates persons who have very early disease who have not developed fusion as yet, and that's our aim, to prevent fusion of the spine.